Today we'll be talking about understanding symptoms. Today we will discuss how to distinguish between cardiac and non-cardiac related symptoms, what angina is, and how to manage it appropriately. Symptoms can be very individualized, so some people will describe symptoms such as shortness of breath, fatigue, nausea, heartburn, heaviness, lightheadedness, an achy feeling, or a tingling sensation when they are describing their symptoms. Though it may be difficult to distinguish between cardiac and non-cardiac related symptoms, there are some key features that can help you determine where your symptoms are originating from. This presentation will help give you some guidance on good questions to ask if you are trying to decide if a symptom is coming from your heart or somewhere else in your body. Pain, discomfort, or other sensations may originate from muscles, joints, nerves, or connective tissues. When we think about our symptoms, we want to think about, can we pinpoint our pain or sensation? Do your symptoms change when you press on or massage the area of the body? Do the symptoms change or get better or worse when we adjust our body position? Have you recently injured yourself or have a history to injury to the area? Have you recently participated in strenuous activities or exercise? As something called delayed onset muscle soreness can occur 24 to 72 hours after exercise. This commonly occurs when we begin a new exercise routine and/or change our intensity. Are you experiencing feelings of stress or anxiety? Heartburn can present similarly to cardiac-related symptoms. Ask yourself, do I have a history of indigestion or heartburn? Did I do something to provoke the heartburn, such as eat spicy, acidic, or greasy foods? Are the symptoms relieved with typical measures, such as antacids? If the answer is no to these questions, it is best to seek medical assistance. Cardiac-related symptoms are referred to as angina. Angina is the medical term for chest pain or discomfort caused by a temporary disruption in the flow of blood and oxygen to the heart. People describe angina discomfort as a squeezing, suffocating, or burning feeling, usually in the center of the chest or behind the breastbone. Angina occurs when the heart does not receive enough oxygen-rich blood. This can occur during vigorous exercise, high-stress situations, or with exposure to extreme temperatures. Angina symptoms may present as pain, discomfort, squeezing, pressure, heaviness, burning in the jaw, neck, arms, or back. Symptoms may also include weakness, nausea, cramping, or shortness of breath. This is why it's important to run through the non-cardiac related symptom features before we think about our cardiac related symptoms. Here are some tips to avoid angina. Perform a warm-up and cool down with each exercise session. During warm-ups, heart rate and blood pressure gradually increase, preparing your body for exercise. Arteries begin to widen, allowing blood and oxygen to easily circulate through the body. Cooling down helps the body return to a resting level. Avoid heavy meals or overeating prior to exercise, as the body will naturally shift blood to the digestive system and away from the heart. Avoid exercising in extreme temperatures. Use the nitro spray if you have been prescribed. If you have been prescribed nitro, ensure that you have it with you at all times. Ensure you are seated when administering. Spray into the air a few times before taking the first dose. Spray underneath the tongue. Wait 5 minutes. If symptoms persist, spray the second spray under the tongue. Again, wait 5 minutes. If symptoms persist, spray the third spray under the tongue and call 911 at the same time. Do not administer more than 3 sprays. Do not shake the bottle and always check the expiry date on the medications. If you've run through both the checklist of non-cardiac related symptoms and cardiac related symptoms and you believe that 911 should be involved, please make sure that you are calling 911 as the ambulance will take you directly to the most appropriate hospital. Also, do not drive yourself. If you drive yourself and your symptoms begin to worsen, you could put yourself as well as others on the road at risk. Thank you. Moving on to test your knowledge. What does the term angina mean? Another term for heart attack: chest pain or discomfort caused by nitro spray, chest pain or discomfort due to the heart muscle not getting enough oxygen-rich blood, or aching in the knee joint. The answer is C. Chest pain or discomfort due to the heart muscle not getting enough oxygen-rich blood. Throughout the program, we want to be working on goal setting. We always want to ask, are you working towards a goal? What went well with that goal? What can we do differently? And how can the exercise therapist support you in those goals? For more information, speak with your exercise therapist, visit our website, www.gethearthealthy.ca, or visit the calendar of live events on the website.